So in this module, we will review some strategies to identify reproductive hazards at the workplace and provide some resources. So there are several strategies that may be implemented in order to identify reproductive hazards in the workplace and take preventive action. These include checklists that you use to identify physical and biological agents as well as hazardous activities. You may also review, but should not solely rely on, safety data sheets, also known as SDSS. You can also review SDSS for chemical products as required under the Occupational Safety and Health Administration's Hazard Communication Standard. You can also use guidance documents, fact sheets, and other resources available for employers and workers, in addition to using an Occupational Reproductive Health Accident Prevention Program template to guide your work. You can also consult experts for further assistance. So in the next few slides, we will briefly describe what these strategies entail. So the first strategy that I mentioned was the use of a checklist to identify physical and biological agents as well as hazardous activities. Here is an example of a checklist for identifying reproductive hazards at the workplace. This checklist was developed by the Safety and Health Investment Projects, or SHIP, grant team by the University of Washington. This checklist may also be used by employers and workers who may want to keep their family planning plans private, and includes a checklist on different workplace conditions such as the ones depicted here. For example, some of the working conditions on the checklist include whether the worker is expected to work long hours or overtime, whether it's necessary to stand or sit for long periods without a break, or whether workers are given easy access to restroom facilities with associated hygiene facilities. Another one of the sources that I mentioned was safety data sheets, which are formerly known as Material Safety Data Sheets, or MSDSs. These are sheets for chemicals that are being used at the workplace. Safety data sheets, or SDSs, include information such as the properties of each chemical and the physical, health, and environmental health hazards associated with this chemical or mixture, as well as protective measures and safety precautions for handling, storing, and transporting the chemical. They also can provide guidance on things such as what personal protective equipment or PPE to wear, as well as first aid procedures and spill or cleanup procedures. Current safety data sheets also provide information on whether a substance is a potential reproductive hazard. One important thing to note is that you should try to use the most current SDSs, as those preceding 2015 do not have information on whether the chemical substance is a potential reproductive hazard. When using safety data sheets, you should make sure that you are using the most up-to-date safety data sheet and look for the required health hazard pictogram for reproductive toxicity, as depicted here. Hazard pictograms form part of the International Globally Harmonized System of Classification and Labeling of Chemicals, or GHS. GHS is an internationally agreed-upon standard managed by the United Nations that was set up to replace the assortment of hazardous material classification and labeling schemes previously used around the world. Core elements of the GHS include standardized hazard testing criteria, universal warning pictograms, such as the one depicted here, and harmonized safety data sheets which provide users of dangerous goods with a host of information. So here are some of the required hazard statements for reproductive hazards in a safety data sheet. According to the Globally Harmonized System of Classification and Labeling of Chemicals, or GHS, these statements are intended to form a set of standardized phrases about the hazards of chemical substances and mixtures that can be translated into different languages, and the statements you see here are related to known or potential reproductive toxicants. For example, if the substance is suspected of damaging fertility and damaging the unborn child, then the SDS would need to indicate the code H361F and include that statement. Here is the sample safety data sheet with information related to reproductive hazards. We can see here that the substance has been classified as a reproductive toxicant, category 2, which means it is a suspected human reproductive toxicant. Substances are classified into category 2 for reproductive toxicity when there is some evidence from humans or experimental studies, possibly supplemented with other information, of an adverse effect on sexual function and fertility or on development, and where the evidence is not sufficiently convincing to place the substance into category 1. If deficiencies in the study make the quality of evidence less convincing, category 2 could be the more appropriate classification. Another resource that may be useful is using databases like ChemHat, or the Chemical Hazard and Alternatives Toolbox, which is an internet database that provides easy-to-use information on chemical safety and may be used to identify potentially safer alternatives or substitutes. Here is a sample of the information available on ChemHat. In this case, we have formaldehyde, and we can see that there is suggestive evidence that it may cause endocrine disruption, impacting reproduction, and there is also information on birth defects. We can see here that formaldehyde could cause harm to the developing fetus, including birth defects, low birth weight, and biological or behavioral problems that may develop as a child grows. There are many other resources available online, including pamphlets, booklets, fact sheets, and other databases. Here is an example of a pamphlet produced by the University of Washington that is meant for protecting workers from occupational reproductive hazards. There are also resources available from the National Institutes of Occupational Health and Safety, or NIOSH, on reproductive health and the workplace. Other resources are available for employees, healthcare professionals, and workers as listed in this slide. Another resource includes accident prevention program templates that are designed to address reproductive health. The purpose of the template is to help prevent adverse occupational reproductive health outcomes, and this entails identifying reproductive hazards in the workplace, as well as identifying the work groups covered by a job or job task, describing strategies to control exposures to reproductive health hazards, ensuring workers are trained on the reproductive hazards and exposure control procedures. This is important because workers that might be exposed to hazardous reproductive agents during their first trimester may not be aware that they're expecting, so education and prevention are key. In addition, clinicians may also receive little to no training on workplace hazards and reproductive hazards. Lastly, another key part of this program is that employers should monitor manual labor and other work conditions to ensure that workers are protected. Another strategy to be aware of reproductive hazards at the workplace is to consult experts. You can pay for consultation services from private sector industrial hygienists, occupational health nurses, and other safety professionals. There are also free resources available online, including the mother2baby.org website. The Mother2Baby website is a service of the nonprofit organization of Teratology Information Specialists, or OTIS. This is a reputable source for evidence-based information on the safety of medications and other exposures, including chemical exposures during pregnancy and while nursing. The Mother2Baby website also has several other resources, including fact sheets that may be useful for employers and workers. Lastly, always keep in mind the hierarchy of controls. You should consider if you can implement elimination, where you modify the work process to eliminate the reproductive hazard, or substitution, where you select a safer chemical that is equally effective. You may also implement engineering controls like local exhaust ventilation and closure of noise sources, mechanical lifting devices, or other engineering controls, followed by administrative controls, such as rotating workers to reduce exposures, or if requested, accommodating workers who may be pregnant or nursing. Lastly, applying the use of personal protective equipment, or PPE, which includes respirators, gloves, and other PPE. However, you should always make sure that they fit the worker and protect them from the task at hand, particularly when we're talking about pregnant women. So in summary, women face unique and disproportionate workplace hazards. These can include workplace violence, ergonomics, stress and workplace organization, workplace design and personal protective equipment, or PPE, as well as reproductive hazards. We also learned that several factors may play a role in reproductive health, such as timing of exposure, duration of exposure, agents and hazards that the particular worker is exposed to, dose, and other factors. Lastly, strategies and resources are available to protect reproductive health at the workplace. Thank you for your time, and I hope you learned something new about women in the workplace and how they may be exposed to unique and disproportionate hazards.